So psychiatry is a mess, and maybe this one's harder to understand than the next one I'm going to mention, but basically their drugs haven't been subjected to, for the most part, to sugar pill studies, right? And their studies are entirely based on opinion, mainly supplied by psychiatrists who are paid by these corporations. And their manual, the Diagnostic and Statistical Manual, it's a big yellow book, right, that lays out all their theoretical diagnoses and treatments, is essentially paid for by the pharmaceutical companies, who directly pay virtually all the authors of that thing. And it's essentially a treatment manual to prescribe medications. And these medications are damaging, and they are addictive, and they cause enormous problems that are well known but are ignored, and they are passed out like jelly beans. And we now have 17% of our populace taking prescription anti-anxiety and antipsychotic and anti-depression drugs. I mean, it's just insane on the face of it. These things have been correlated with increasing dependency on various programs, you know, like workman's compensation and so on and so forth. And we think, the observers think, it's caused by the medication. So the sequence goes: industry stimulated the use of these things for profit. The people became chronically ill instead of off and on ill, because a lot of these illnesses, depression and anxiety and even psychosis, come and go. But when you take these medications, the people enter the system and never go out. It's like the Hotel California. They're stuck because the medications damage their brains, and they basically become chronic wards of the state, and they take these things. And sometimes they're given monthly injections of stuff that basically poisons their ability to recover. So of their medications, right, you've heard of Prozac and the SSRIs, right? Those are antidepressants in theory. Those things were, the marketing for those is that they cure a chemical imbalance in the brain. You probably heard that too. Well, that was a marketing thing and not science. That was made up in the marketing department of one of these drug companies. They don't do that. They're toxic and they create big changes, but they're not specific antidepressants, and they create a lot of violence and suicide. And this has been well known since the earliest studies of Prozac, and it's been come out in court discovery. The second group is, you've heard of the benzodiazepams like Valium and Xanax. Those things are fantastically addictive. The studies of Xanax originally showed 3 weeks of improved behavior, 2 weeks of non-improved behavior, and then for the rest of the study, the last month or whatever it was, the patients definitely got worse as the drugs were withdrawn. So they're addictive, and they take a long, long time to withdraw from. Sometimes months, sometimes you can never get off of them. Another class of drugs they use is called the atypical antipsychotics, and those shorten lifespan by 10 to 20 years. I mean, it's unbelievable. Psychiatrists pass these things out like jelly beans. Yeah. So anyway, psychiatry is a mess. There is a significant number of people who believe that psychiatrists should not be practicing. And this includes other people besides the Scientologists. I mean, there's a significant number of psychologists and so on who think that their approach is overall damaging. So I can get into another medical specialty field as an example of the corruption, if you'd like.
Yes, sure.
So oncology, or cancer treatment, is, these people have a difficult job. They treat people who are declining and in the last phases of their life sometimes, and have difficult, complex diseases. But for some reason, and it's obviously money, the drug companies that supply the chemotherapy drugs have been granted an exemption to the kickback laws. So they are allowed to pay the oncologist or cancer doctor 20% of all the drugs that they give in their office. So this creates a tremendous conflict of interest, or perverse incentive, to use the most expensive, the newest, and And they get rewarded in some cases by the milligram. In other words, the drug rep can call up the doctor and say, look, you're at 2,300 milligrams this month. If you get up to 2,800 milligrams, you're going to get the 10% bonus. So they're rewarded in some cases for prescribing more than perhaps so these drugs, they cost $100,000 a year. The oncologist gets 20%, $20,000 for sitting their patients down in the Barca lounger and monitoring while the chemotherapy is given in their office. So it's crazy. Their treatments are, only a few of their treatments are effective. The vast majority of treatments for cancers only prolong life by less than 2 months. We have a few cancers that can be cured, right? We've got a few lymphomas, testicular cancer, leukemias, some of them can be cured, but most of oncology is ineffective. So those are a couple of examples. I mean, if you want to read, I got so tired of nasty doctor stories in Butchered by Healthcare that I wrote about some hero doctors too. So, it's otherwise it's just too dark a story.
Yes. No, I understand. A lot of things that you're naming are things that, because I'm curious and I'm kind of obsessed with information and things that are even outside of the knowledge that I have. And one thing I noticed from the psychology is that there some of the things you named, for example, of the medication, and one big problem that I see is in therapy, one of the standards, and you referenced the DSM-5 book I think you're referring to,
yeah.
That psychologists in psychiatry, because I noticed, for example, psychiatry wasn't working for different family members that I had. And I was trying to figure out why, just because I'm curious and I'm obsessed with information. So one thing that I noticed from researching some of the most profound psychologists of our time, like Carl Rogers, for example, they have one of the standards is unconditional positive regard when it comes to dealing with a client. And the problem with that is that person develops congruence. When you constantly tell them everything's fine, you're going to do well, you're doing good, take the medication, and that doesn't seem to work to fix the problem. You're just kind of helping a person along in life. Now psychology is a tough area, and I'm not targeting the doctors in any sort of way, but there are some things that need to be talked about, like such as we're doing now. And another thing that I saw is, from a behavioral perspective, behavioralists have over time have given argument to psychologists in this type of behavior that it doesn't work. See, what a behavioralist does, they try to change actual habits about your life in order to better you, not give you unconditional positive regard and, oh, everything's going to be fine, everything's going to be good, because of the problem of having congruence and feeding, and then as a result of that, feeding people too much medication. See, a behavioralist says, listen, you have a problem with this, we're going to work on this every day, every week, every month, every year, until your behavior changes to where you're able to handle this situation. Not feed you a whole bunch of medication, and not me coming in here massaging the fact that everything's just going to be okay. So that's just one thing that I've noticed, for example, in psychology, that there are some problems that, and I'm glad that you offered that information in that area.